Bien, amigas, amigos, Café con Leche continúa la mañana de hoy. Y hoy, con esta ola de calor, estos calores tan intensos que se están sintiendo en estos días, existe un gran peligro, y es que muchas personas en estos días padecen de dolores crónicos y se intensifican estos dolores. Para conversar con nosotros en la mañana de hoy acerca de qué podemos hacer nosotros, si algo, tengo al doctor Pergolizzi. Doctor, good morning, how are you?
Good morning, Hector. Outstanding, and thank you.
Thank you, doctor. It's my honor to have you here at Café con Leche, our morning show in WRCH. It's very hot out there, doctor. Does the heat intensify some muscular pain? Is that true or is it a myth?
Hector, great question. And yes, extreme temperatures and heat, very cold or very, very hot, can definitely change the way your muscles and joints are feeling pain. Mm-hmm. And heat actually worsens more than cold pain. And what's worse, Hector, is when we combine hot weather mm-hmm. with high humidity, then that heat index, the combination of both, the hot temperature and the humidity, mm-hmm. the heat index causes even more types of pain for people who have osteoarthritis or muscle or joint pain.
Okay. Which are the chronic pain disorders that are most affected by the heat?
The ones that I see in my practice are arthritis, back pain, fibromyalgia, multiple sclerosis, mm-hmm. and chronic migraines. People get chronic migraines because of the heat as well.
My wife is one of them, doctor.
I'm sorry to hear that.
Yes.
I'm sorry to hear that, Hector.
Now, doctor, I know that you know a lot about this. 4 ways to alleviate the pain on the heat without using pills or have to schedule a doctor appointment.
This is a really good question, and people have to listen closely mm-hmm. because the 4 things you can do. The first, choose being in the shade over being in the sun. So you want to move into a cool place, cool mm-hmm. yourself down. You want to stay hydrated. Look, what does that mean, Hector? You want to limit the amount of alcohol and caffeine intake. And I know people enjoy a beer or a mm-hmm. glass of wine in the summer. I certainly love my espresso coffee because I'm Italian in the morning. Mm-hmm. But we need to limit that in the hot weather and stay hydrated. We want to wear breathable clothes and pack a bottle of water or a portable fan wherever you go. And finally, you want to add your pain cream to your sunscreen. And I've created a product called Instaflex, which is an oxygenated natural oil in combination with menthol that allows for that to happen. So if you have these muscle pains and mm-hmm. aches, you want to put that on first, let it soak in, and then put your sunscreen on. But don't forget your sunscreen.
Doctor, I have a question. What works quicker, pills or topical relievers?
Another great question I get asked all the time. Mm-hmm. Joints are closer to the skin, such mm-hmm. as your knee and your elbow, and they can absorb pain relievers relatively quickly and show positive effects faster than much oral over-the-counter pain relievers. Mm-hmm. And also, you can take another dose of the pain cream mm-hmm. more quickly than you can take a second dose of most over-the-counter medications. Mm-hmm. Example, Instaflex you can use 4, even 5 times a day. A lot of times with other medications, you have to wait 8 hours before you can redose mm-hmm. them.
Doctor, what about shoulder pain?
Shoulder pain is very popular. You mm-hmm. know that, Hector, unfortunately.
I do have that right now.
Yeah, so with shoulder pain, what I suggest is a combination of the topical pain relievers, and I can tell you that in a recent survey mm-hmm. of pain doctors like myself, they mentioned that almost 100% of them would suggest always starting with a topical pain reliever. And that's what this recent survey showed. but you want to include that with stretching exercises and maybe some hot compress and some cold. So heat and ice in combination with the topical pain relievers and stretching is a good way to start.
Doctor, there's any topical pain reliever that you can recommend, or that depend on the area or the pain?
Well, that's another great question. I can suggest Instaflex. This can be found at healthydirections.com. It's a combination of an oxygenated oil, which people really like that concept, with menthol, which is a known pain reliever. And combining the both of them, what I've found in the clinical studies is that we get very good pain relief for muscle and joint pain in particular. So like the shoulder problem you have.
Okay. Dr. Pergolizzi, when is necessary for me to call you or call my doctor when I have pain?
Perfect question. You know the way I like to look at that, Hector, is I like to think of it as red flags and yellow flags.
Okay.
Like when you're out on the beach, right? So, you know, a yellow flag is something that, you know, you want to start thinking about going to the doctor because you start to see that the pain isn't really getting any better. And it's been a while. It's after 4 weeks and you've been doing everything you can. A red flag, okay, if you rest and you get hydrated and you're cooling down after you've been out in the sun and it doesn't alleviate the cramps, you want to see a doctor. You want to talk to a doctor immediately if your temperature doesn't come down or your symptoms get worse. That's really important. Another thing, Hector, remember, babies require a follow-up medical attention after they have heat symptoms, even if they get better when they're at home. So you always want to do that. If you have joint pain that's not going away, that's red, it's inflamed, it becomes more stiff, again, these are all red flags that you should go see a doctor about.
Okay. Doctor, please tell me the real truth. Why people experience more pain in hot temperatures compared with cold temperatures?
That's a great question, and I wish I had a real strong answer for you, but we just don't have enough research. What I can tell you is this, that a lot of times when you're dehydrated and you're walking around and doing activities, this can cause the buildup of lactic acid, and that lack of proper hydration on top of the fact that you're sweating and you're depleting your electrolytes even more. And when we combine hot temperatures with humidity, the heat index has a great impact on us, particularly older patients. So that's why a lot of times people are going to say that their extreme temperature and heat is going to be more painful than in the cold. And look, Hector, right now, if you look across the United States, Texas, Alabama, Georgia, Florida, we're having a heat index that's really high. It's scorching out there. So don't forget, you want to choose a cool place, stay hydrated, wear, you know, breathable clothes, and combine that pen medication with your sunscreen. You want to stretch and you want to rest.
Doctor, I have to say that I really, 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 really thank you for this answer, because I suffer sometimes from cramps. And my doctor told me once, can you please drink a little bit of Gatorade or Pedialyte before go to bed? And that's going to help you a lot. And it's really true.
That's right. You know, if you think about it, being dehydrated is one of the things that causes you to have cramps and muscle pain, etc. So I would say this, your doctor's right on target. Take a little bit of electrolytes like Pedialyte. There are some sports waters that have it, Gatorade. And you also want to make sure you get rest. I mean, look, Hector, I bet you've been working since early in the morning. You know, make sure you rest. Make sure you stretch. Get up out of that chair. Move around a little bit. All these things are going to help with good muscle and joint health. And don't forget about supplements. Again, you can find some great supplements at healthydirections.com. These things can also help decrease inflammation and help with good joint and muscle health.
I don't want to let you go, doctor. What other issues should we consider when it comes to pain and heat?
Yes, one thing that you need to be really concerned when it comes to pain and heat is that you can have the heat stroke, and this is when we get exposed to heat very, very bad. This is something, again, that can cause you to be dizzy, more nausea and vomiting is associated with things like this, and can even make your cramps worse, your muscle and joint pain cramps worse. So again, go into a cool place, cool down, rehydrate. There's no badge of courage for living through pain. You want to address that pain, and you want to be able to properly get out of the heat, cool yourself down. And remember, if you see that after hydrating and cooling yourself down, the temperature doesn't come down in your body and your symptoms get worse, seek medical attention.
Doctor, where we can go and get more information about all this topic of pain and heat? There's any website that you recommend?
Yes, I can. As a matter of fact, I'm just publishing an article right now
called The
Heat. The Heat is On. I thought it was a catchy name. The Heat is On. You can see more information at www.drpergolizzi, that's DRPERGOLIZZI.com. There's a lot of good resources and explains more in detail the science behind how oxygenated oil with pain-relieving menthol works. And you can also find more information about Instaflex on that website. Again, www.drpergolizzi.com.
Intraflex is the name?
Yes, Instaflex, INSTAFLEX.
And only can be buy online, doctor, for now? Or?
Yes, I think online and in GNC. It also
okay.
has it.
Very good. Doctor, 3 things: rest, stretch, and caution.
Yes, that's it. You want to really make sure that besides getting out of the cold, out of the sun, and hydrating and wearing portable clothes, you do want to rest and you want to stretch, and you want to have good nutrition. Hector, think about it. It's a whole thing. You got to get your body back online. Hector, I'll tell you one nice thing that some people do to relax their body. They take their shoes off. They go outside, they just dig their feet into the soil. That's called grounding, and that's a really nice way just to take a break. Because remember, we're all under a lot of stress. We just went through COVID. We got a lot of things going on. So we got to really address that sort of timeout period for ourselves.
Doctor, I would love to have another hour to talk to you. You've been great. I want to thank you in the name of our community. Thank you very much, and I'm sure this won't going to be the only opportunity that we're going to have to talk to you about different topics regarding our health. Thank you so much, Dr. Pergolizzi.
Thank you very much, Hector, and thank the whole entire community. Stay cool and enjoy the summer.
Thank you.
All right, you got it.